I did appreciate your anecdote about, ask the person about their wishes when it was in the context of deciding about chemotherapy. I do want to make a point that our research has shown that too often we make assumptions that the person or the patient is a knowledgeable consumer, and that it's as simply as asking them, what do you want us to do? Like as if they can just verbalize, their the wish, and we should follow that wish. And although at face level, that sounds like what we should be doing and is consistent with patient-centered care, when you go a level deeper and you interrogate people as to their understandings of the risks and the benefits and the possible outcomes and options, they don't have that understanding. So for example, we go into hospitals, we ask people what they know about cardiopulmonary resuscitation, what they know about the process of care, the outcomes of care, and they have no clue. And yet we go to their medical chart and they're signed up for CPR. So they bought a package that they had no idea what the process or the outcome was, because we treated them as an autonomous person that should be able, if we just ask them and they tell us, oh, okay. And so I'm trying to dispel the myth that simply asking people is the solution. It's way more complex than that. And it speaks to a role of what we call decision aids, medical decision aids. And again, Plan Well Guide is an example of that medical decision aid, where we're explicating the risk, benefits, and options and outcomes of the difference between going to the ICU or staying on a hospital ward and receiving medical care, or receiving comfort care only. And so part of my initiative is to better inform people, what these different treatment options are, so that when they say, I want CPR, then they really know what they're getting. We've got a 7-minute video decision aid on CPR, for example. Again, my issue is that we have these materials, we have these decision aids, but they're not embedded into the healthcare system. And so people don't get exposed to it. And doctors keep asking the question, well, when your heart stops, do you want us to resuscitate you? And what's an older person who doesn't understand any of this supposed to say other than, okay? And so they get signed up for CPR.